Alrighty.
Yeah.
So it's 10:01, and I would like to start our seminar series, presentation series for from the Freeman Grant from the Soulmate Center. I'm the PI. We have been trying to advocate for optimal aging tips for older adults, caregivers, and family members, or anyone who is interested in caring or wanting to understand more on healthy aging is welcome to this presentation series. So the first one was done by me on sleep, and that is recorded and uploaded at the Soulmate Center webpage. And also today we have our special speaker, Dadriane Fice, who is a nurse who has great experience on caring dementia and Alzheimer's care, and also a PhD student at our college. So, Dadriane, can you share about yourself and maybe start on the art of caring today?
Okay, great. Thank you for having me. Good morning, everyone.
Good
I'm
morning.
Dadriane, and to tell you a little bit about me, currently I am a PhD nursing student, but before returning to school, I worked as a staff educator, and um, among some of the things I've done is training staff um, in dementia care. So training staff how to provide care to persons with Alzheimer's or dementia. And it's also very personal to me. I'm a full-time caregiver for my mother and uncle, both of whom have the disease. So um, I'd like to talk about some of the strategies um, in providing care. This is usually a part of a 7-part course, so I'm going to touch on some of the areas over the next few moments. Um, I will start now with an introduction. What you see on your screen is a poem that I used to share with family members when they would move their loved ones into my facility. It became a poem that I've kept with me over time. I like to read it, and I like you to just kind of listen to the words. It's from the standpoint of the person who is struggling and suffering with dementia. The poem is called Do Not Ask Me to Remember. Do not ask me to remember. Don't try to make me understand. Let me rest and know you are with me. Kiss my cheek and hold my hand. I'm confused beyond your concept. I am sad and sick and lost. All I know is that I need you to be with me at all cost. Do not lose your patience with me. Do not scold or curse or cry. I can't help the way I'm acting. Can't be different, though I try. Just remember that I need you, that the best of me is gone. Please don't fail to stand beside me. Love me till my life is done. This poem is by Owen Darnell. And I always begin talking to staff members about putting themselves in the shoes of the person who has the disease. Can you imagine not being aware of what's going on, but being able to tell that something is different? From my experience, that's the only warning that I had when my mother was diagnosed with dementia. She just told me something's different. I'm not right. So I also like to talk about what is normal aging. Um, so basic forgetfulness. like forgetting names and appointments, things like that, immediate recall types of things, signs of normal aging. Forgetting things like this morning, I forgot my keys. Sometimes I have to look for my keys. Those things are considered normal aging. Um, but I will challenge you to kind of wrap your mind around where dementia is beginning. So consider what dementia is. When is normal aging and forgetfulness something totally different? So just think about that for just a moment. Okay. So consider, is it dementia or is it delirium? So the best way that I like to define the difference between what is normal versus what is not normal aging. Consider the example of the car keys. I forget my car keys. I can't remember where I've placed them. Normal part of aging. It's the point at which I forget what the keys are used for. Are they for my car? Are they for my house? Actually, what are keys anyway? It's the point at which you're forgetting the intended purpose or function of something. You have to begin to consider dementia. So I always like to define dementia more so as a condition where a person has a set of difficulties in problem solving skills, or maybe their slight memory is affected, or orientation and appropriateness of something, appropriateness of behavior, mannerisms and etiquette, behavior in relationship to their environment. Consider what is appropriate. I'll use the example of a birthday party and a cake with candles. When you see the cake with candles and the candles are lit, most people would know what the function and what that situation entails. Oh, this is a birthday party. I'm to blow out the candles. Consider the person with dementia who may be uncomfortable in that specific situation, not realizing what the candles are for and what the situation is. The person with dementia may not be able to identify that they're at a birthday party. Okay. So this slide, often I spend probably a couple days or so just kind of ironing out the differences. But this is a quick reference for you. Dementia versus delirium. Think of delirium as something more acute confusion brought about by an illness. Example for clinicians may be a person who is needing treatment for a UTI, and you notice that they're confused and have some behaviors or something of that nature. That could be considered more of a delirium or encephalopathy secondary to an acute illness. So delirium would be the rapid impairment of intellectual function, disturbances, disorganized thinking, disorientation, something that comes on quickly and gradually goes away. Also, you could think about confusion in the hospital. Um, Patient is admitted to the hospital or intensive care and they become acutely confused in that environment. If you've ever worked in intensive care, there's like an ICU psychosis that comes along with being discharged from that setting. They sometimes are confused when they're released to the regular hospital environment. But dementia is a specific condition. Consider it an assault to the brain. Consider Alzheimer's disease dementia as an assault to the brain. It is truly a brain attack. It has a slower and a more gradual decline that's not reversible. Even if you treat an acute illness, even if you change an environment, dementia will continue. You cannot fix the cause. Okay? So many memory problems are considered maybe a normal part of aging, but with Alzheimer's disease and other forms of dementia, it's not just simply a forgetfulness, and it's not something that's normal to aging. It is something that the person cannot change. They will not be able to fix it, and it will become progressively worse. The person who has dementia is losing their ability to think clearly. They're losing their ability to reason. They're losing their ability to decipher. They don't recognize normal conditions. And as they go through that brain assault, it sometimes can bring out a more behavioral type of manifestation, causing changes in personality, or even affecting their mood. Um, and this process is progressive. So as they go through the stages of dementia, the stages of Alzheimer's, things are getting progressively worse, and their ability to function in any setting is getting progressively worse. Eventually, dementia will lead to the inability to manage daily life and functions of daily life. And by that, I mean everything associated with living from day to day. So I like to give a little bit of information relating to maybe the anatomy and the physiology associated with dementia. I do say that it is a brain attack. So consider some of the physiological processes going on with the brain. There's actually damage to brain tissue. So I like to talk about plaques, tangles, loss of synapses between brain cells, inflammation, and then eventual death of brain cells. So plaques are microscopic clumps of protein called amyloid peptides. Tangles, you can think of it as twisted microscopic strands of protein. Think of loss of connection. Think of synapses or spaces between the brain cells. Synapses are inhibited. The transformation of information from cell to cell impact memory and learning and communication. These functions are affected for the person who has dementia. Inflammation can sometimes result in the brain's inability to fend off lethal effects of other changes that are taking place, all progressive within the brain. And eventually, you have a death of brain cells. So you have the full healthy brain, and then you have the brain that is severely affected by Alzheimer's disease. And if you click on the slide, you can see the change. So I just like to show this slide, and I used to show this to my family members. This brings to mind a particular family member who had trouble accepting that her mother was diagnosed with Alzheimer's. She could not gather that mom can't function. And so we would have meetings in the facility for family members, and I would teach them the same as I taught the staff. This particular slide I would use for shock value, just to drive home the point that there is a change in brain tissue and makeup. And I always use this slide so that they could see that something was truly changing, just like you show for the smoker who has lung damage. Sometimes you have to show with Alzheimer's and dementia, to make it a reality, you have to show people that there is actually injury and assault to the brain. So that is why Mom may not remember how to do things, how to function. That is why this particular family member um, would always want to take her mother out in public. And as the disease continued to progress, mother started to lose the ability to understand how to dress, how to get into the car, how to have the proper etiquette in public. So um, we would talk about with our group sessions, we would talk about the family members' feelings after seeing this particular slide. And I think it was helpful for staff too. I did do this for my own family, um, just to get people to understand in the family that, there is really something taking place. The brain is always, my opinion, this is strictly my opinion. It's the organ that everybody assumes is always 100% functional, perfectly well. So um, we have to remember that the damages that are caused in Alzheimer's dementia are not things that'll be reversible. There is no way to regenerate the tissue that's lost and restore the cell function. Some of the medications move towards mimicking some of these functions, but it's never a restoration of true function. So that is a little bit of background on the disease. I don't like to dive into the anatomy and physiology, but at this point, I begin to talk to the staff and family members about caring and how it is a particular art form. Um, it is something that I had to learn to do for myself in my own family. So, being a nurse and taking care of my mother, I thought it would come easy to provide the care. But until this point, my background had been acute care, intensive care, and everything flowing the way that I needed it to. I will tell you that caring for a person with Alzheimer's dementia in any stage is a particular form of art. It is a form of caring that's going to differ day by day. So let's talk about some of the symptoms of dementia. When should you begin to be concerned that maybe your loved one or a particular person may have dementia? So I talked about memory in terms of what is normal forgetfulness, losing keys versus losing the knowledge of what the keys are for would be consideration. Losing the ability to concentrate and focus. So think of a particular task that we all do every month, like budgeting, paying your bills, things like that. Think of the skill required to watch a movie. To some degree, you have to pay attention to the content, uh, analyze what's taking place. These are things that we do without even thinking about it. But for the person with Alzheimer's dementia, this ability is severely hampered. Their ability to remain oriented, their spatial skills and ability. I'll stop a moment and talk about this visuospatial skills in particular. This is something I learned a lot about with my family member. So I moved my family member into my home without realizing that I would need to make changes to the home. Think of a floor with a checkerboard pattern. So walking my mom in from the garage, my kitchen floor had a black and white checkerboard pattern. It never occurred to me that what the person with Alzheimer's dementia sees is different than what I'm able to see. I see a flat surface and I can easily take a step from the garage through the doorway into the kitchen. My mother came to a complete pause. It wasn't until later that I learned that for the person with Alzheimer's dementia, that checkerboard black and white floor looks like pits and valleys, steps and holes. And she was fearful. On the black areas of the floor, she was fearful that she was stepping into a hole. So she stopped moving through the doorway. At the time, I was a little bit bothered by that and trying to force her to do it, not realizing the fear. So just keep that in mind that patterns and things like that appear differently in their vision than it does in ours. Language is affected, judgment is affected. An example would be I'll talk about a particular resident in a facility where I worked. Um, he had the experience years past of being in a flood. And so whenever housekeeping would polish the floors or they would wet the floor or he'd see anything like that, he would go into full panic mode because he was unable to judge reality versus something else. And he was reliving an event that happened years past. His judgment was affected by that. Another example would be my family member once got out of the house without the ability to get back in and recognize how to get back to the location where she lived. So that would be another issue. And then sequencing. What comes first? So you never think when you get up, get dressed, start your day, you never think of the sequence of what you do. You comb your hair, you brush your teeth, you get dressed, but how do you do those things? So consider for the person with Alzheimer's dementia and talking about the symptoms of dementia, often their ability to sequence those things is affected. Think of putting the toothpaste on the toothbrush, but now you don't know what step comes next. So these are realities for them, and these are just some basic considerations. You may need to see a neurologist and determine if dementia is actually a concern. I'll talk a little bit about the stages of dementia. Some of the literature will point to 7 or 8 stages. Often when I teach this course, I will list 7 full stages and talk to staff in a greater detail. But when I'm talking to family members, I try to talk about 3 specific stages and identify some behaviors that will kind of stick and that are easy to remember. So in the early stages of dementia, think of behavioral problems. Now, mind you, these things may be unrecognized by family members or primary caregivers. Consider that the person with dementia may become easily angered when they make a mistake, or the caregiver will become easily angered when the person with dementia makes a mistake. The person with dementia is often aware that something is changing, okay? And they can become quite abusive, quite irritated when you try to correct their mistakes. I'll give you an example. My mother is a great baker, but I noticed she mixed up the ingredients when she was making caramel. So I tried to tell her what the ingredients are and the directions for making the caramel. Big mistake. Big mistake. She became embroiled at me, and the whole process that I was trying to make a pleasant one was foiled, and we had to stop the activity. Keep in mind that the person with dementia is aware, often aware that something is changing. Consider also that most behavioral problems are a direct result of their memory loss. Think of that picture of the brain. Normal brain, the brain that is struggling, the brain with Alzheimer's, the brain with dementia, the organ itself is changing. They are truly losing the ability. Think of some of the behavioral problems that may occur in middle stages. I talk about behavioral problems because these things are easier to manifest or visualize and pick out. So think of in middle stages, it becomes a little more bit more pronounced, a little bit more severe. They become paranoid. They're suspicious of everything. You know, you never think of caring for your parent putting them in a situation where they're suspicious of what you're trying to do. But as the tables began to turn and I needed to take over more things or activities of daily life for my mother, she was kind of suspicious. Like, why are you doing that? What are you saying? Are you saying there's something wrong with me? That sort of thing. Be mindful of sleep disturbances. And that could be in part because the person with dementia, like I said, is recognizing that something is changing. You can't sleep well if you don't know what the next step is going to be. And sometimes this leads to wandering behavior. In the home, it's concerning because you want to keep the person with dementia inside and don't want to have them wander away from a safe place. So these are just some of the things to consider. Behavioral problems in the late stages, the person with dementia may actually become disruptive, screaming, yelling, belligerent, improper language. They may become resistive to care. Think of the patient in a nursing facility who absolutely refuses to bathe and constantly resists interventions from the caregivers and personal care. It may not be that they don't want to do it. They may not recognize the need or be able to consider the judgment that, oh, I need to bathe now. Or they may not have the skills of sequencing to know what to do next. And they become argumentative when you try to provide redirection. So communicating with a person with dementia can be challenging. How does dementia specifically affect communication? I often tell staff members that communicating with the dementia patient is going to be paramount to getting anything done. And it's okay if you can't communicate with them. Sometimes you have to back away and reapproach. So think of the struggle stroke patients have with aphasia. Think of that type of concept. They have difficulty finding words. They have memory loss, so they may not remember what you're talking about, but they don't say so. They have difficulty following conversations because their ability to conceptualize and interpret and their ability to sequence and concentrate is affected. And they resort to using automatic speech. They may use curse words. So I heard my mother say some choice things that I had never heard her say before. Very, very challenging when family members have to work through those things. Reading and writing is also sometimes difficult for them. Automatic speech is something that confuses people. When I talk to staff and families about automatic speech, so there was a gentleman in our facility, and I think of him specifically because whatever you said to him, he would say in the kitchen. That's what he would say. Whatever you would say, he would say in the kitchen and continue talking about whatever it was. But in the kitchen became a way that we knew from inflection how he said it, the impact or what he was trying to communicate. So if he's screaming in the kitchen, we knew something was wrong. Or if he said in the kitchen with a smile, we knew that something was right. He was happy about something. We just had to identify what that thing was. Had nothing to do with him being in the kitchen. So just know that if you've worked with stroke patients before, some of the similarities are there. I'll talk a little bit about types of behavior to be mindful of. I go into detail with when I'm talking to nursing staff or caregivers that are providing care in the home about these types of behavior. But specific types of behavior that you're going to encounter for dementia patients: incontinence, sleep disturbances, inappropriate sexual behavior, wandering, difficulty performing personal tasks, paranoia, agitation, sundowning, and catastrophic outbursts. I'm going to take a few of these that I think are the most common, but I think all of these are things to consider. So let's talk about dancing as an art form. And I think everybody might recognize this person, but I like music and the arts, and I like old movies. So this is Fred Astaire. Um, Fred Astaire and Ginger Rogers, very skilled, fancy footwork, kind of like Michael Jackson too. But I think of Fred Astaire. So to dance is an art form. And what we're going to do is learn how to be artful in the way that we're doing the dance. So I often talk about each interaction, you're doing a dance. And it's just your judgment on how your partner is going to perform. So think of yourself as the lead, you're Fred Astaire, and your partner is the dementia patient. Okay? And think of all the things that dementia entails. So the first behavior I'm going to talk about in terms of the art of doing the dance is incontinence. So what are some of the things or art forms that you could use to address incontinence? Keep in mind, for the dementia patient, simplification goes far and does wonders. Don't complicate things. So to assess or to manage incontinence, simplify the clothing. Use contrasting colors on the toilet and on the floor. It helps the dementia patient visualize it better. If the floor is dark and the toilet is white, or the toilet is a particular color and the floor is a different color, think about ways to change the environment that will be helpful for them to visualize. Provide positive reinforcement type of situation and allow them to be independent. You can schedule times to do a particular task, and you can simplify things by establishing a set routine. Routines are very important for dementia patients in terms of doing the dance. So the dance would be, and how you execute it would be how you use these things upon each encounter. It's going to change every day what it is that you need to do. Okay? The art of doing the dance continues. So I'm just going to talk briefly about performing personal care tasks. That's always something that comes up. I can't get mom to take a bath. I can't get mom to brush her teeth. One of the methodologies I tell staff members to use is to divide things into smaller steps. You have to be patient. Don't rush them if they cannot figure out what to do. And always, sometimes if you demonstrate what to do, the person will repeat and follow your lead. Use simple phrases a step at a time, paraphrasing, reassure them, and set them up for success. Don't set up a situation where there are too many things to do. Don't say, we need to get dressed, comb your hair, paint your nails, put your socks on, and we need to leave by a certain time. That's just a hodgepodge of words, and you've just confused the situation. So keep that in mind in your performing tasks. Remember, it's the art of the dance. Think of Fred Astaire, dancing on air, and just be patient and meet them where they are. Sundowning, agitation, catastrophic outbursts. These are things that occur more so in the evening as the hours progress from 2 p.m. going into 4 p.m. onward. If you know anybody in a facility, visit them during that time frame. You'll find that the place is erupting. So Consider what could be the cause. Could it be pain? Evaluate their medical needs. What if they're a coffee drinker like I am and they haven't had any all day? Schedule rest periods for the dementia patient. Consider the noise and stress factors. A calm and quiet um, environment works best. Once again, do not put them in a situation of failing. And don't just throw out questions. Are you sick? Are you hungry? Are you thirsty? It's all too much for them to process. And then look at medications too, how these things may affect their performance. I used to tell the staff, please don't turn the television on and put it on MASH or um, Me TV where they're watching Hawaii Five-0 or something like that. Don't use the television as a babysitter um, because they think it's a real environment and they could become stressed by it. Don't turn on the news and have all the televisions around on CNN where they're seeing the latest shooter. They may see that they're really in a threatening situation. So keep in mind those things and think of what's age appropriate, what's situational, and what's appropriate in that vein. And if you can eliminate the cause of something, do. Okay. So summarizing what I've said, keeping the dance simple. Keep it just a simple, light environment. Don't let them see your frustration and have patience with them where they're able to perform. I just want you to take away um, from this discussion expectations, some basic communication skills, some environmental considerations, tasks, routines, and activities. Um, each of these I talk about at a great length when I do the 7-part series, but expectations, just keep in mind that it's a progressive illness and continue to look at your own attitudes and simplify your expectations of what it is they're going to be able to do. In terms of your communication with a dementia patient, remember to simplify, simplify, simplify. I keep saying that. Simplify your content or whatever it is you're asking or how you form sentences and words. Use a slower pace and be concrete. Say concrete things. They can't think in abstractions. Use familiar terminology and phrases, words that the person knows, words that they're able to use. These things may be cultural, like there's some cultural things. My mom is Southern, so there are certain things I say to her and she can still gather what that means. So use things that are familiar for that dementia patient. Consider the environment. I had to get rid of that checkerboard kitchen floor that I love so well, right? So remove clutter. Don't keep things overcrowded. Think of falls. You know, if they're having trouble with spatial differences, consider the fact that they could fall. There tends to be a higher number of falls in Alzheimer's units and things like that. So give them an environment where they can move freely and be comfortable. And in terms of day-to-day tasks, sometimes I'm in a rush. I'm rushing off to class or whatever it is I have to do. I had to learn how to break things down into smaller steps. That means sometimes if I know I'm going to have to go to work or go to class, I can't start an activity 15 minutes before I need to leave. I need to be prepared for the fact that it may take longer for my mom with dementia to perform that activity. And think about breaking things down into small steps, okay? Demonstrate things. So we work together like after meal times. Sunday is usually our time. We break those tasks down, the dishwashing. I'll give her the task of drying if I'm washing dishes, things that she's used to doing the right way versus what actually works, okay? Routines, keep them structured. Do similar things at the same time each day as best you can. And in terms of activities, find out what is meaningful. for that person with dementia, what is meaningful and purposeful in their lives and what is pleasurable for that individual, and learn how to do that simply so that they're going to be successful. And last but not least, I always say, um, enjoy the dance and the music. It is an art form. It is an art to caring for someone with dementia. So thank you, everybody, for listening.